for Public Health and Professional Standards led by the Honorable Muthoni Muriuki. And all those state departments form up the Ministry of Health, the one that treats and the one that prevents. So doctors treat, we prevent. And we always say prevention is better than cure, but treatment is so costly. But in this country, we appear biased towards curative. We do not embrace preventive interventions. And that's why you can be able to see the rise of the burden of disease. For example, communicable and uncommunicable diseases, cancers, hypertension, diabetes are actually on the rise because we're actually not investing heavily in prevention. You know, the other day I saw a court giving a ruling that shisha people should actually be allowed to smoke shisha. And you know, you look at it, like while we agree with the bench, while we respect the bench, we also supposed to protect the public health. And you know, when we talk about, for example, shisha and tobacco, you all know very well how cancer is actually causing us a lot of issues. Tobacco, consumption of tobacco, for example, lung cancers, talk about cardiovascular diseases. Those are communicable diseases and non-communicable. That's actually on the rise. So we don't expect, for example, a court surely to sit down just because of a bureaucratic delay in the Ministry of Health to be able to publish the regulation on shisha and smoking rules, to be able to allow shisha to be smoked. Surely it's not fair in a country like ours. Actually, it's like we're actually setting up our nation to diseases, actually exposing Kenyans to issues with the cancers and other. We should be discouraging smoking. We should be discouraging use of shisha, water pipe shisha, all those things, tobacco products. So when you see such a kind of a thing, you know, it becomes so interesting as a country. But nevertheless, because we are citizens who actually abide by the law, we respect, but as professionals, as public health professionals, we actually do not agree. And I believe as a union, we are actually going to move and appeal that decision. If the ministry is going to appeal, as a public health union, I want to break, we're going to appeal because we actually want a healthy nation. We don't want a sick nation.
Brian, maybe you can tell us other preventative that people are ignoring that are very basic, because I think you've mentioned some would fall under lifestyle, but you're the expert. Which others? Yeah.
Like I said, for example, we are talking about, for example, I'll give an example, an easy example about malaria. Malaria typically is a preventable disease. And you know, usually when you're actually talking about malaria, it simply means people sleeping under a mosquito net. For example, you go to Nyanza, go to other areas in this country, you realize that most people don't sleep under mosquito. Our pregnant mothers, our children actually are exposed to malaria. And you know, malaria has actually been claiming lives since time immemorial because of simple issue like sleeping under a mosquito net. Things like washing hands, for example, cholera, things like TB, tuberculosis. The other day you saw about COVID-19 when we actually a simple measure like washing of hands and actually social distancing proved very, very important. Actually in controlling COVID-19. So I think we need to be very alert how we eat, even how we eat, how we walk, physical activities. Actually, if you look at what's actually going on actually in our major towns, we're talking about urbanization, we are busy setting up structure. And I'm not saying it's not bad even to do affordable housing. It's good to do housing. But you know, when you're doing housing, you need to also be very careful because what you're actually saying, what we're doing in it, we are reducing the green spaces. How do people actually, for example, walk? Are we actually taking care of the activity of our people, the physical activity? And that's why you'll be able to see diabetes and hypertension on the rise. So what we are saying is that we need to make sure that we invest heavily in the preventive aspects in this country so that we can be able to make sure that our Kenyans, we don't project a disease country, we need to project a healthy nation. And the Ministry of Health is not a ministry of diseases. That's what we call Ministry of Health, for the obvious.
Hot 96.